At a glance, it isn't much to look at, but this repurposed treatment center in Eastern Democratic Republic of Congo is helping turn the tide of an mpox outbreak that has triggered a public health emergency. Once, it served as a host of Ebola patients, but now desperate mothers can bring their children here to be treated for mpox.
When he developed many skin lesions, he stopped eating. His eyes swelled. So I decided to take him to the health center, and there they told me to bring him here. Since we arrived, his eyes have turned to their normal shape, and even the lesions he had are now just scabs. The medicines they gave him are working.
Mpox was declared a global health emergency by the World Health Organization in mid-August after a new strain of the virus began spreading from the DRC into neighboring countries. 2 years before that, a different strain spread globally. Vaccines were repurposed within weeks in high-income countries to protect those most at risk, and have now reached 1.2 million people in the United States alone. But in much of the global south, the vaccines have remained out of reach.
It is really outrageous that after COVID, we're going back into the same situation, that, the African region once again doesn't have access to vaccines easily, and that to actually get access is requiring these very complex negotiations with WHO as a conduit. That is not the way that we should be going.
We want to not see what we saw with COVID and we've seen with other emergencies where countries start to stockpile. Even though we understand the drivers for people saying, I need to protect my own country, the best way to protect your own citizen is to contain the outbreak at source sooner rather than later.
Next week, 10,000 mpox vaccines are finally due to arrive in Africa, the first doses outside clinical trials to reach the continent. The slow arrival of the shots, which have already been made available in more than 70 countries outside Africa, show that lessons from the COVID-19 pandemic have been slow to bring change. A host of factors continue holding back vaccine access, including slow approval from regulators and lack of funding. Experts maintain that vaccines are key to cut off the chain of transmission, but the question is how long it will take to reach everyone in need. Mohamed Abubakar, CGTN.